Esteemed participants, good morning and welcome to the Industry, Academia, Government Collaboration International Symposium. My name is Takahiro Sasaki, and it's my great honor to serve as your MC today. We are gathered here at the Kanagawa University Minatomirai campus for an event themed Imagine the Future of City to Achieve Well-Being. This symposium is a collaborative effort brought to life by Yokohama City University and Kanagawa University. Together, we aim to explore how cross-sector collaboration can create a sustainable and prosperous urban future, enhancing well-being for all. Our esteemed speakers will present innovative insights on building smarter, more resilient communities and fostering meaningful collaboration among all stakeholders. Before we begin with our first keynote address, it is my honor to introduce two distinguished leaders whose visions and support have been instrumental in making this symposium possible. First, please welcome Professor Takehiko Ogawa, Vice President of Yokohama City University. We are privileged to have him here to share his opening remarks and set the stage for today's deliberations. Honored guests, please join me in welcoming Mr. Takehiko Ogawa.
皆さんおはようございます。
Good morning,
さんおはようございます。
Good morning, ladies and gentlemen.
英語でやらせて
Now, please change into
Good morning, everyone.
Japanese.
Kind introduction. Thank you for the kind introduction. My name is Takehiko Ogawa, Vice President of Yokohama City University. I'd like to begin by expressing my deep gratitude to everyone for attending this international symposium on industry, academia, and government collaboration. The title is Imagine the future of city to achieve well-being. I'm truly delighted that we are able to host this event together with all of you. I would also like to extend my sincere gratitude to Kanagawa University for kindly providing us this wonderful venue today. At Yokohama City University, under the leadership of Professor Miyazaki, who is presenting today, we are selected in 2021 for JST's COINEXT program. In April last year, we were also selected by the Ministry of Education, Culture, Sports, Science and Technology to participate in a project aimed at promoting industry, academia, government collaboration at core regional research universities. Furthermore, this year, we have opened the Co-Creation Innovation Center as a hub to facilitate collaboration between industry and researchers. As a research university, we are committed to creating new values and innovations through these partnerships. Today, we have the honor of hearing from prominent figures, including Professor John Fu Lee from Yonsei University, Mr. Takehiko Nagumo from the Smart City Institute, and joining us online, Professor Pamela Collins from Johns Hopkins University. From our university, we are proud to have Professor Miyazaki presenting as well. I'm sure their insights will be invaluable as we work together toward building a well-being society. Achieving a well-being society requires strong collaboration between industry, academia, and government. Through today's symposium, I hope to explore with all of you what new forms of well-being we can create together. Lastly, I'd like to express my hopes that today's symposium will be both meaningful and enjoyable for everyone. And with that, I conclude my opening remarks. Thank you very much.
Thank you, Mr. Ogawa, for those enlightening words. It is now my great pleasure to introduce Professor Makoto Obuma, the president of Kanagawa University. We are honored to have him here to offer his valuable perspectives, and we embark on today's sessions. Please give a warm welcome to Mr. Makoto Oguma.
神奈川大学の学長の小熊でございます。
I'm Oguma, the president of Kanagawa University.
よかったんですけど。
I should have asked the interpreter to interpret my remarks. However, I have prepared English opening remarks, and therefore I'd like to make my remarks bilingually.
Welcome to Japan and Okinawa, Kanagawa University. I am Makoto Oguma, president of Kanagawa University. Thank you very much for attending the International Symposium in Industry, Academic, Government Collaboration. Imagine the future of the city to achieve well-being, co-hosted by Yokohama City University and Kanagawa University. I would also like to extend my gratitude to those participating outline from US and Korea. On behalf of the co-organizing universities, let me say a few words on this occasion. In July 2023, Kanagawa University concluded an comprehensive achievement with Yokohama City University. Together, we are committed advancing education and research, not only to lead in Japan from the metropolis of Yokohama, but also to extend the reach globally. Currently, there is a pressing need to Japan to promote genuine industry, academia, government collaboration on an occasional organization level. In the case of industry, academic, and government cooperation between organizing technology and information tend to become closed on. However, we believe that academia needs to embrace the concept of open science regarding the social implementation of research result and adopt a balanced open-closed strategy. I believe that today's symposium can be positioned an open forum when stakeholders from industry, academia, and government who share the same awareness of the issue of well-being society can come together and share information. I understand that Dr. Collins is a world leader in the field of public health, and Dr. Lee is leading runner in the field of smart city research. In addition, Mr. Nagumo is one of Japanese leading experts on smart cities, and Dr. Miyagi is one of Japanese leading researchers serving assistant to the president of Yokohama City University as a young. I'm very much looking forward to hearing from a distinguished professor about their advanced approaches. As the organizer, I'm pleased if today's symposium will promote the opportunity for everyone to think about how Yokohama can be developed as well-being small city. I would like to conclude my regards by wishing you a successful symposium. Thank you for listening.
Thank you, Mr. Oguma, for your insightful remarks. Next, we are honored to hear from Professor Hiroki Yoshida, Vice President of Kanto Gakuin University, who has graciously offered his comments for today's event. Please join me in welcoming Mr. Yoshida for his remarks.
Thank you so much for introducing me. Well, good morning, all. I would like to begin by thanking Dr. Oguma, President of Kanagawa University, Dr. Ogawa, and Dr. Tachibana, Vice Presidents of Yokohama City University, for your warm hospitality. I would also like to express my gratitude for the ongoing collaboration of Yokohama City University and Kanagawa University, which is aligned with Yokohama's global vision. It is my great honor to be here today on this occasion to discuss the future of the well-being city, Yokohama. Indeed, it is my privilege and my pleasure to deliver a few words on this momentous occasion. Yokohama, which is a dynamic international city that has welcomed diverse cultures and communities from around the world for many decades. The city actively supports initiatives to build an inclusive society where people from different backgrounds can live together harmoniously and contribute to the city's growth. This international character provides a strong foundation for creating a society where everybody feels valued and connected. When considering well-being in Yokohama, I think it is essential to understand the unique characteristics of Japanese well-being. Research by Cousins indicate that American people often themselves with personal or psychological traits such as I am honest or I am confident, while people from Japan usually describe their selves using some social categories such as I am from Yokohama or I am the eldest son. Marcus and Kitayama describe these perspectives as an independent view of self versus an interdependent view of self. Cultures with an interdependent view, such as the United States, place a high value on self-esteem or individual success. In contrast, cultures with an interdependent view, such as Japan, prioritize harmonious relationship with others. So Uchida and Rapley posit that happiness or well-being in North America is associated with feelings of excitement and pride and a sense of pride. Happiness is considered to be wholly positive and is based on personal achievement and self-esteem. In contrast, happiness and well-being in Japan and East Asia are more calm and intimate feelings, which are referred to as relationships and a sense of belonging to the society. So, as one of the oldest universities in Yokohama, Kanto Gakuin University has upheld the motto, be human and serve the world. Guided by this philosophy, we have been promoting community-based learning as means of contributing to the society and well-being of others. In alignment with our school motto, we have identified 5 key stages of community-based learning. The first is know, I mean understanding the community and the society. The second is see, which is observing the society. The third is think, which is thinking about the society. The fourth is act, which is collaborating with the society. And the last one is reflecting on the learning process. This community-based learning framework facilitates the integration of education, research, and community. Through these efforts, Kanto Gakuin University's aim to contribute to the well-being of Yokohama City. And as a member of this well-being-focused smart city, we are promoting cooperation with local governments and local businesses. We are willing to make every effort as part of the academic community to support Yokohama's vision of a better future. Thank you so much for your attention.
Thank you very much, Mr. Yoshida, for your thoughtful and inspiring presentation. We deeply appreciate your support and presence at this symposium. With our opening remarks concluded, we are now set to delve into the heart of today's symposium with 4 exciting talk sessions led by esteemed chairpersons. For our first 2 sessions, it is my pleasure to introduce Professor Atsushi Goto from Yokohama City University. Professor Goto will guide us through the discussions of Talk 1 and Talk 2. Please join me in welcoming Professor Atsushi Goto to the stage to chair these sessions.
Thank you for your introduction. Good morning, everyone. So now, I'm delighted to introduce our first speaker, Professor Tomoyuki Miyazaki from Yokohama State University. Dr. Miyazaki is a professor at the Research and Industry Academia Collaboration Promotion Center, and he also served as an assistant to the president at our university. Dr. Miyazaki is a respected leader in promoting multidisciplinary collaboration with a particular focus on improving the well-being of young people and addressing the challenges they face in society. As a project leader of the YCU-COINEXT, he plays a key role in partnerships between industry, academia, and government, working to find solutions for youth well-being. And he is also an established researcher in the field of neuroscience. So I hope that he will make an exciting talk from the aspect of neuroscience. Dr. Miyazaki, please.
Okay, it's nice to see you, and thank you so much to Goto Sensei for kind introduction. Well, now I'm talking about the mental health problem in Japanese youth, and could you show me the slide? How to open the slide? Do you know? Oh, okay, thank you. Okay, so as you know, many percentage of Japanese young people are now suffering mental problem. So it just not met the clinical diagnosis of mental illness. So pre-symptomatic. So it means slightly depressive, and we cannot devote myself to work and study, including all aspects the key topics of young people's mental problem in Japan, and as well as US and European country, and I think as well as in Korea. Well, now we are living in Japan. We know the many kinds of numbers showing the serious mental health problem in Japanese youth people. So this percentage, 15.3, this is the number of Japanese youth who answered it will get better. When he asked, how do you think about the future of your country, I mean Japan? So this absolute number does not have a meaning, but once compared to US data or European data, so it is very shocking number. Exactly saying, Chinese data, so who said we are getting happy, is increasing up to 80%. And the US and also European country almost so same number, 70 or like this. So why we get such a situation, such a serious situation these numbers show that. This picture shows the background of mental health problem in Japan. Left side is the number of truant. Truant is a student who are absent from school. So now it is almost up to 3% of total students are absent from school. And especially in junior high school is increased up to 6%. And this rate is now gradually increasing from now on. So we need to find a solution to prevent this increased number of these truant. And also, right panel shows the prevalence rate of mental illness in chronological order. Left bar is 29, so it's almost 20 years old data. So it is a little bit fine to show that better 61%, this is the number of the prevalence rate in 40 years. So as you easily mentioned that hard work, tough work, and very fully stressed is attacked the working adult and decline and depression and go to the mental health doctor. It's meaning this kind of number. But once from 26 to 2023, 2023 is the last year's number, and the blue area shows 43.9%. This is the prevalence rate of 10 to 20s. So this circle graph shows the prevalence of young age is rapidly increasing in just less than 20 years. So this data is suggested is contributing to the number of 15.3 the people who had imagined the good future in Japan. So now we've launched a big project supported by YCU-COINEXT, and for 2 years. We are now find a solution and how to implement this solution to young people to recover mental health problem. So, you know, there are many factors to contributing to ikizurasa, either say in difficulties in living or tough life. So abuse, poverty, bullying, isolation, loneliness, and over-interfere over children from their parents. But these kind of items is also included in social determinants of health factor. And these factors is contributing to the decline of mental status. So our target is youth with mental problem, just not met clinical criteria with mental health, also pre-symptomatic status. So our previous research showed that our survey to college students revealed that person with their mental disorder is up to almost 50%. And the very shocking number is that suicidal thought, who has one suicidal thought, is up to almost 1/4 of total number of students. And regarding working adult depression, but strictly saying this is not clinical criteria of depression, but slightly depression and cannot devote myself to work or school. This pattern is increasing up to almost 30%. And this factor is leading to school refusal and losing a job, as well as social withdrawal. So, you know, in Japan, the number of social withdrawal is coming up to 1.5 million. Many huge number of people are suffering from social withdrawal. And as I mentioned in the previous slide, school refusal is now coming up to 3% of total students. Is a crazy number, I think. So they are recommended to consult with some other third person. I mean, go to hospital and meet a doctor or a consultant, or if they're student, he can get much opportunity to discuss and consult with school counselor. And also, Yokohama City or other cities has a service, public service, to consultant with these kind of young people. But it is very easy, not easy for them to access these service. So maybe it is very easy to imagine. So young people, it has a depressive status and visit mental clinic and see a doctor. So it is easy for them. Maybe it is very hard. So our project include the casual, so I mean the hospital to visit easier for the young people in Japan using IT technology, including metaverse or online. So this is a very important development for young people who has suffering from mental problem. And Hara-sensei is here, and here the one team leader of YCU-COINEXT. He have already calculated the economic loss due to mental problem. Upper number is due to social withdrawal, and right number, lost annual income is increasing up to 16 billion US dollar. And this is just loss of income due to they are absent from working. But when their social withdrawal, family and other people are caring to cover their life. So supporting housing cleaning and provide food or something like that. So these hard stuff increase, leading to decline of mental problem in family, especially parents. And this kind of problem is leading to the loss of presentism-related family, 226 million US dollar. It's like that. And below is a mental problem issue related to working adult. So left side, 9.4 billion US dollar is due to public mental medical care expenses. So I mean, once people get a depression and met a doctor and diagnosed with depression, he has covered by public health insurance. So this sum up to this number. But pre-symptomatic, I mean the who didn't meet the clinical criteria with mental disorder, but they are suffering their mental status is calculated by hidden cost. So you know, presentism, as I mentioned, cannot devote themselves to work and school. So this kind of presentism causing 33 billion US dollar annually. It is very crazy number compared to the public health mental care expenses. So this number, how to recover, we should do that. So just one government, just one company, and also just one university cannot resolve, cannot propose a good solution to recover this situation. So what we should set up to improve mental health of youth? The first step, everyone cares my and other, I mean friends or somebody around them, mental status. So casually saying, we can talk casually about mental problem issues. And the second step, everyone can know easily how their mental health status. So I talk this kind of topic in various situations, university or corporation, but many people ask me, how can I get to know our mental status? But actually, currently, we can provide some devices and some service to know how your mental status is. So including smartwatch or some device including smartphone, so be a voice or some finger. So these devices can get to know how is the mental status in our situation. And finally, everyone can access easily to the information and the services to improve their mental health. These three steps are essential for improve mental health of youth. And this is data obtained from Nagumo-san's Smart City Institute, Japan. And quickly saying, this green circle is hard aspect. I mean, young people want to have a good school and a comfortable public space, and they're a very hard aspect. But nowadays, very soft. I mean, the contributing factor to the mental or physically or internal inside of a human being is very hot topic. So it's like atmosphere is comfortable for me, and surrounding are too fun and physically healthy, mentally healthy, as well as self-esteem. How can I achieve this goal? So we need to discuss with very frequently between government and industry and academia and citizen. So now currently we are studying team to discuss about the solution as well as the basic information underlying mental health problem. So Hara Sensei organized this research team, and once a month over 30 people gather in the face-to-face meeting and discussing for 3 hours and 1-3. And finally, their proposal to industrialization of mental well-being of youth. And this is a representative picture. Many people are engaged in discussion for well-being of young people. And why do we need to evaluate the well-being in young people? So this is the data from Arimoto Sensei and Imamoto Sensei in our team. Left longitudinal number is PHQ-9 is a depression score. High score is depression, and the low score is good in mental health. And transverse axis is Palmer, is a positive psychological symptom index. And the number is increasing means happy, and the lower index is unhappy. And this is a very clear negative correlation, but you mentioned that so wide variety of the representative, I mean individual number. So once this data categorized into 4 sectors: 1, for flourish; 2, low mental health; 3, low happiness; 4, devastation. So it is very interestingly, we usually check their mental status. We usually use PHQ-9, only PHQ-9 or something like depression score. But we should do that, neglect well-being index to evaluate the status of mental problem. So Type 3, low happiness. It means not depressive, but not happy. This population is almost up to 1/3 of totally young people. And why this number is a problem? Left side shows the presentism score. So you can check, you can compare type 1 and type 3. Type 1 means flourish. Type 3 is not depressive, but not happy. And this picture shows the, so not mentally healthy, but mentally, no problem in mental health, but not happy is causing to the higher presentism. So compare 1 and 3. And the right side show is more strikingly to me, odds ratio for suicidal ideation. So type 1 flourish and type 3 is low happier people. So once they get unhappy, the odds ratio for suicidal ideation is increased up in 8-fold compared to flourish. So this kind of data suggested us that we need to check well-being over young people as well as depression score. And just to slide. Now we are currently discussing with the Board of Education in Yokohama City, and now our project is survey of mental health in junior elementary school and junior high school in Yokohama City. And we've already decided what indicator is suitable for the detect of mental problem. Left side and upper one is visual analog scale. So the students are asked to check their mental status 0 to 100. So we're using finger. So 100 is very nice. 0 is severe problem. So in every morning, these young students are asked to check their mental health status. And once a month, more detailed research provided to the student, including depression as well as well-being. So we calculated this data and leading to the plan to recover these individual students for getting more healthy. So far, this kind of mental health problem in education is limited in the education field. I mean, teachers or school counselors. I mean, they're not open to medical staff or medical team, but we recommended that these data should be open to medical team, including us. So once we calculate the data from the student, we discussed with school counselor and school teacher to carry out the therapeutic plan for the young people who are suffering from their mental problem. So this interesting strategy is coming up from Yokohama City. This is epoch-making to improve young people's mental health in Japan. Well, these are members of our YCU-COINEXT team, and over 115 people are engaged to this project, and every day they are discussing about the plan to how to recover, how to improve their mental status in young people. So thank you for JST's and YCU-COINEXT team for kind support me to carry out our project. Okay, thank you so much.
Dr. Miyazaki, thank you very much for your exciting talk. So do you have any question to Dr. Miyazaki? Are there any? Oh, Dr. Omura.
宮崎先生, or Dr. Miyazaki, thank you very much for sharing the very exciting and very specific case studies and data. Because I'm one of the young generation, young adult generations, and therefore including this type of events. The fact that you have been so proactive in this field encourages me quite a lot. You have presented specific scores, what we can use. However, if these initiatives are used at the Yokohama City level, in addition to that, if you consider the collaboration among academia, private and public entities, what are the strengths or what we have to consider in terms of the PPA collaboration. The reason why Yokohama City is embarking on this project is right now there are the 240,000 elementary and junior high students. So population is very high. However, Yokohama City has the independent education board different from other municipalities, and therefore there is the benefit or the advantage of reaching all of the 240,000 elementary and junior high school students. In addition to that, for each ward there is a diverse variety in terms of the income level and diversity, and therefore the Yokohama City can be the epitome of the any cities in Japan, and therefore if anything successful here in Yokohama can be rolled out to other municipalities and prefectures logically. The other point I'd like to refer is that regarding with education, for instance, you know the giga terminals such as iPad and Chromebook. And then there's a data held by private companies such as the learning supporting system and mental supporting systems that are already available. That's why those systems should be introduced to the terminals, so they not only by the government-led initiatives but also private-led initiatives or tools should be shared, especially for the public schools. If it's realized, all of the educational aspects can be opened, and which will be leading to the more open discussions. And then we can nurture the culture where we can open mental problems. Of course, I cannot disclose specific companies, but now we are about to start such initiatives.
Okay, thank you so much. So, yeah, okay. Thank you again for your great talk and discussion, Dr. Miyazaki. Okay, next, we are very pleased to welcome Dr. Pamela Collins from the Johns Hopkins Bloomberg School of Public Health, where she leads the Department of Mental Health. Dr. Collins has made remarkable contribution in connecting culture and mental health within academic and governmental contexts. She has received several prestigious awards, including the NIH Director's Award for her work in global mental health research and the NIMH Director's Award for her outstanding leadership in advancing mental health care. She has recently published a remarkable paper in Nature where she performed the international survey for mental health friendly city, and she gathered over 500 panelists to do that survey, and she made a remarkable statement about 40 to 50 statements from the survey. And I hope that she will present some of the findings of her exciting international survey in this presentation. So I'd like to introduce Dr. Pamela Collins for her talk. Dr. Collins, could you please start your lecture?
Yes, thank you so much. It's such a pleasure to be here. I'm so grateful for the invitation to participate with all of you this morning. I'm going to talk about making cities mental health friendly for young people. This will be a somewhat high-level talk, so I won't go into all of the details of our studies, but I would like to cover. So Consequential phenomena are intersecting in our world right now: increasing urbanization and increased need for action on adolescent mental health. So first, adolescent mental health is a growing global health priority. In the United States, our Surgeon General has recognized poor mental health among adolescents as a public health crisis. The authors of the recently published Lancet Psychiatry Commission on Youth Mental Health note that the mental health of emerging adults from age 12 to 25 has been declining over the past 2 decades. The COVID-19 pandemic accelerated this trend, but it's likely that global megatrends, and these are the society changes that we see in specific locations, but also around the world, have contributed to declining mental health and well-being among young people. These include demographic shifts towards an aging society in many high-income countries, and these societies now need young people to carry the financial and social needs of a dependent older population. So there's an expectation of a role that young people need to play in many of our societies. A second megatrend is climate change and insufficient action on climate change, which has caused climate anxiety in some settings. But in many settings around the world, young people see the threats of climate change to their environments and to their futures, and they experience the disasters and trauma associated with climate change and are looking for answers. But this creates an existential threat for many young people. Another megatrend is the unregulated and unsafe digital and social media environment. Another is social exclusion, and by that, the commissioners refer to insecure employment, poor access to affordable housing, rising intergenerational inequality. These also contribute to poor mental health. And finally, urbanization is another megatrend that has implications for youth mental health, some which are positive, but some which may also be negative. So urbanization is one of the most significant trends of the last 2 centuries, with rapid growth over the last 50 years and continued urbanization expected over the coming decades. Almost 1 billion people will become city dwellers in the next 15 years. The question to answer is, can improving cities improve youth mental health? What we know is that more than 1 billion people around the world live with a mental health condition. And these conditions are occurring in young people as they're understanding who they are in the world, as they begin higher education, start jobs, enter new romantic relationships, get married, begin families. And they can disrupt healthy transitions to adulthood. Mental disorders have been associated with school dropout, low earnings, incarceration, suicide, and homelessness, as I'm sure you're aware of. Most of these conditions emerge in adolescence. The period of adolescence is a dynamic, and young adulthood is a dynamic period of psychological and social development, and a sensitive period for the incidence of mental disorders. A recent meta-analysis shows that about 35% of mental disorders begin before the age of 14, nearly 50% before the age of 18, and around 63% begin before the age of 25. These are some data from the 2021 Global Burden of Disease study, which are estimates of the prevalence of a group of mental disorders in emerging adults. And in this particular data set, we're looking at ages 10 to 24. I think the takeaway from this is that these conditions are common. They occur across cultures and geographies. The prevalence of mental disorders in this selection of countries, this is simply a selection that I chose to show, ranges from about 11.4% in Nigeria to a high of 24% in the United States. But equally important is the emotional distress that young people report that does not reach the severity of diagnosis, but still affects their relationships with family and friends, their school and work life experiences. So some of the other consequences of mental ill health or poor mental health are, of course, diminished well-being, decreased productivity, increased risk of mortality. And I want to sit with this one for a minute. We, of course, often think of suicide as the leading cause of loss of mortality related to mental health conditions. And in fact, the 2023 data from the World Health Organization show us that suicide is the fourth leading cause of death for 15 to 29-year-olds globally. But co-occurring mental health problems are also linked when they co-occur with communicable and non-communicable diseases. These are also linked to greater morbidity and mortality among young people as well as adults. One example, which I'll talk a little bit more about, is the increased risk of HIV acquisition among people with certain mental health conditions and the increased risk of mortality for people living with co-occurring HIV and depression. The presence of depression, we have data from a cohort in sub-Saharan Africa, as well as data from North America, showing that the co-occurring presence of depression and HIV increase risk for all-cause mortality. So how do we think about the urban environment and adolescence? Well, key to adolescence growth, development, and mental health are their interactions with the environments that surround them. And urbanization is a leading force that is shaping environments in the world. More than half the world's population lives in cities, and cities offer greater opportunities for health, for jobs, education, and social freedoms, but they're also places of density, crowding, noise, and pollution that can increase stress and overload. Rapid urbanization deepens disparities and can expose people to considerable adversity, placing their mental health at risk. The overall research is complex on these issues, but it points to urban living as a risk factor for poor mental health in many settings. So we see higher risk for anxiety, higher risk for depression, and higher risk of psychosis. Now, young people under the age of 25 are the demographic group most likely to move to cities for educational and employment opportunities. And by 2030, cities will become home to 70% of the world's children and adolescents. So I want to talk about some of the vulnerabilities in an urban setting. Urban adversity can heighten the risk of HIV for young people, and HIV has a bidirectional relationship to mental health and illness. So living with a mental health condition can increase risk for acquiring HIV, and living with HIV can increase risk for developing a mental health condition. And I'm going to talk a little bit about this because much of my research over the past has focused on this intersection between HIV and mental health. And in some cities, this is one of the more significant health risks and mental health risks for young people. So vulnerability to HIV is often higher in urban compared to rural areas. And that's typically because of urban dynamics like migration, unemployment, social and economic inequalities, violence and discrimination, which particularly affect fragile communities like those who live in informal settlements, for example. And UNAIDS defines key populations, which include gay men and other men who have sex with men, sex workers, transgender people, people who inject drugs, people in prisons, and other closed settings. This group, this UNAIDS-defined key populations group, largely live in cities, and their vulnerability for HIV is increased in these areas when there is stigma and discriminatory laws that can actually reduce access to HIV prevention and care-related services. In fact, UNAIDS has an initiative focusing on cities, ensuring that cities work together to meet targets for ending the HIV epidemic. Now, vulnerability to HIV and mental health conditions intersect in adolescence. Because as we know, adolescence is a time of, as I mentioned, the sensitive period of neuropsychological and social development, during which adolescents seek greater autonomy. They take risks and initiate sexual activity. And it's also a critical time for the onset of mental disorders, as we've talked about. So adolescence is a time of sexual debut. Young people are questioning or consolidating their gender identity, their sexual orientation. It's often a time of marriage, adolescence, or pregnancy. Adolescents also experience changes in risk perception, sensation seeking, and their relationships to family as well. This is a time of susceptibility to peer influences and risk for mental illness, as well as risk for HIV, which might come in the form of experimenting with substance use or having difficulty with emotion regulation. Adolescents with mental health conditions can be vulnerable to problems like emotion regulation, which in turn can affect decision-making in sexual encounters. Gender also plays a role in vulnerability for both HIV and mental health conditions. Gender norms are consolidated in adolescence, and they tend to reinforce girls' unequal positions in relationships. Girls and young women can also experience a much higher incidence of depression during adolescence. It's the second leading cause of healthy years lost for adolescent girls and young women. And both of these factors can reduce the ability to refuse sexual advances or negotiate safer sex. And around 60% of adolescents living with HIV are girls. So I'm going to talk a bit about some work that my colleagues and I are doing right now in Kenya. And I'll start by just reminding us that in a selection of prevalence studies that have been conducted across sub-Saharan Africa, these show that mental health conditions among adolescents with HIV, the prevalence ranges from about 6% to 20%. And those same studies compared HIV positive adolescents with adolescents who are without HIV. And you can see the range, the prevalence range of adolescents without HIV is from about 5.8% to 13%. So generally, we see a higher prevalence of mental health conditions among young people living with HIV. And that tends to remain true in adulthood as well among people living with HIV. Now, when we look at the resources for managing the needs of young people with mental health conditions in Kenya, we can see that there's quite a dearth of providers in relation to the population. And particularly, I mean, mental health specialists. So 0.2 psychiatrists per 100,000 population, and just under 1 mental health nurse per 100,000 people. These data come from the WHO Mental Health Atlas. There is no data for child and adolescent providers. And the 12-month prevalence of any mental disorder among adolescents from a recent prevalence study led by Erskine and others was about 12%. So in our study, we're interested in integrating mental health and HIV interventions for adolescents in Kenya. So both increasing access to mental health interventions by bringing them to the place where adolescents would normally get their HIV care and treatment. And when we do this, we're trying to fill gaps that the Presidential Task Force on Mental Health in Kenya has highlighted. That task force has highlighted deficiencies in mental health care competency among non-specialist providers, the need to make mental health care more available in primary healthcare settings instead of large psychiatric facilities. And I've highlighted in bold what's relevant to our work: the need to mainstream mental health services in existing healthcare programs like HIV or maternal child health through mental health skills training for psychosocial staff and HIV workers. So there's an opportunity to equip non-specialists to deliver mental health care in HIV settings. So we are in the midst of a cluster randomized trial that is an implementation study. So it's a hybrid effectiveness trial that is studying the implementation of integrating a mental health intervention into real-world HIV clinics. So we're working in 30 clinics. We have randomized 15 clinics to the intervention arm, 15 to the control arm, which is really care as usual. We're training 2 to 3 providers in each intervention clinic on PROACT, which is our treatment intervention, which I'll say a little bit about in a minute. We're conducting baseline screening on all adolescents and young adults living with HIV between the ages of 16 and 24 in all clinics. And our goal is to enroll 300 adolescents and young adults living with HIV in intervention sites and 300 in control clinics with symptoms of psychological distress. And we will follow adolescents and young adults in both arms at 3 months, 6 months, 9 months, and 12 months after they receive the treatment intervention, and will refer, and in fact are referring, any young people who have severe symptoms for specialist care. The intervention is a brief transdiagnostic intervention that can be delivered in person, one-on-one, or via phone. We pilot tested this and used phones during the COVID pandemic. And trained providers in the HIV clinic will deliver this. So in places where there are not a lot of mental health specialists, resources are poured into HIV care and treatment, one of the tasks is to figure out, well, who in the HIV clinic is the appropriate provider to deliver mental health care for adolescents? And that's one of the questions we're asking in this study. And it's a question that each of the clinics has really selected the providers that they think are most appropriate. Sometimes that might be an adherence nurse, someone who supports the adherence to HIV care, but other times it might be a peer who provides peer support groups to young people. As I mentioned, our target groups are these young people with psychological distress. We expect them to attend 4 to 5 sessions of about 30 to 45 minutes. And we think the sessions will mostly be weekly. Most of them have been weekly, but they will likely be interrupted by young people who need to go off to school. Many young people attend boarding schools, and we'll learn about the best way to complete the treatment and understanding the best cadence that meets the needs of these young people. Our outcomes are depression, anxiety, and trauma scores, but we'll also look at adherence to HIV care and treatment. The treatment, PROACT, is actually a derivation of trauma-focused cognitive behavioral therapy. We have essentially selected these 5 modules from trauma-focused cognitive behavioral therapy, which we did in collaboration with the Nairobi Metropolitan Mental Health leader during COVID, in order to provide psychosocial support to young people who were in distress at that time. So the modules include psychoeducation, relaxation, so psychoeducation providing hope and explaining to young people both the treatment and helping them understand their symptoms. Relaxation, youth are taught to recognize how stress is experienced in their bodies, recognizing the severity of the stress and learning how to relax. Problem solving, using problem-solving frameworks to help youth identify and define problems that are causing anxiety and depression. Behavioral activation, supporting the client who has decreased engagement in social or other activities that bring them meaning or pleasure. And finally, cognitive coping, where youth learn that they're actually able to change their thinking in order to feel better. So the provider explains this with examples about how thoughts and feelings and behaviors are connected. So that's our brief intervention. We are in the midst of delivering this intervention now, and I don't have results for you because our study is underway, but I wanted to just give this as an example of what we can do to increase access to mental health care for young people who are at greater risk for poor mental health, and often we will see a higher prevalence of HIV and the often accompanying mental health problems in urban areas. So I'm now going to talk about how we can identify global priorities for urban youth mental health. And I will talk about the study that we published in Nature and try to present this in a way that doesn't get you bogged down in data, but gives you some of the high-level outcomes. So this was a collaboration. I actually carried out this study when I was at the University of Washington, which I just moved from about just around a year and a half ago. And this was a collaboration between our Global Mental Health Center, which I led, Urban at UW, which was a university-wide effort, still is a university-wide effort focused on the urban environment, mental health emphasis. We collaborated with Cities Rise, which is an NGO focused on urban youth mental health in 5 cities. And our goal was to identify transformative ideas for research and action that cities can take to improve youth mental health. So we did this by using health research priority setting methods. One of those is the Delphi method, and we used a Delphi informed approach. And this means it's a structured communication technique for forecasting and goal setting that involves the recruitment of experts, anonymity in response to the surveys that we administer, and iterative surveying. So surveying, providing feedback, and then looking at a statistical group response. Importantly, we wanted to define a clear focus of the study, use a comprehensive approach, meaning we outlined our methods, our timeframe, our intentions for the results before beginning the study. We really wanted to be inclusive in this study. We prioritized recruiting for broad representation across, really across disciplines, because so many different kinds of people work in cities. You might have healthcare providers, educators, people who work in urban design. There are many different kinds of disciplinary interests, and we wanted to do that. And we also wanted to ensure that we were including young people in this study, some representation of young people. I won't go through all of these points, but these are the kinds of actions that are important to take in a more rigorous priority setting study for health-related research. I'm going to briefly show you what our recruitment looked like. So we began by recruiting a scientific advisory board. This advisory board helped us think about the design of the study and ultimately also helped recruit people to participate in the study. We established an executive committee, which included funders who we thought might be interested in the results of this study as well. We recruited a youth advisory board for young people to make sure that the questions we were asking and the way we asked them and the way we interpreted the data were consistent with the way young people might think about these questions. We developed a concept note to describe the study that we sent to all of the people that we recruited to join the study, and we developed our study design and protocols, of course, prior to beginning the study. And you can see that we had a robust response to the study. This was all online, so we were happy that we got around 500 people to respond to the study and complete the first survey, which was an open-ended question asking what are the factors, what are the most important factors for a mental health friendly city for young people. And people could type as much as they wanted. This was all online, so they had to type it into a form. And And then the second round involved us analyzing that qualitative data, really synthesizing it, and we arrived at a list of about 140 plus statements. And from that list of 140 statements, we did a third survey that allowed people to really focus in a bit more into a smaller set of responses, and ended with 37 responses, which we called our 37 statements about factors that create mental health friendly cities. Excuse me. This just gives you a sense of the distribution of the participants. We had a majority of these are actually WHO regions, so this means South and East Asia. A lot of these were from South Asia. Many of these participants were from Nepal. We had a robust recruitment of educators from Nepal, North America, Africa, where the to care services. Spaces came out. Spaces, the different kinds of spaces that young people need, opportunities, education, you can see. So we asked these experts essentially to tell us, to imagine how cities could support the mental health of adolescents and young adults. And as I mentioned, we identified 37 priority characteristics for mental health friendly cities over the course of our 3 surveys. We grouped these characteristics into a socio-ecological framework that places the young person, we'll call her Nina, in the center, and acknowledges that Nina's personal experiences are shaped by her interactions with the people around her. She reacts to and acts on her family and peer relationships, and these interpersonal relationships are influenced by the neighborhood and community that surrounds them, as well as exposure to institutions like schools and courts, and policies. These, in turn, are nested within political, historical, cultural, and physical environment. And an example of how this works is, let's say that Nina is an immigrant, and let's say that a high court ruling that bars her parents and neighbors from working is passed. This generates stress in the household and questions about Nina's future. And this might show how a policy, something at the outer rung of this model, could affect both a community and a household and interpersonal relationships for one young person. So what did we find? So first, our experts believe that young people need skills that equip them for healthy emotional growth and development, the ability to manage their emotions, reflect on successes and failures productively, deepen proficiencies for personal thriving. Second, beyond the individual, a defining theme of any city supporting youth mental health is the quality of young people's social fabric and the city's ability to provide young people with the skills, opportunities, and places required to build and maintain healthy social relationships with their peers, across generations, and as members of a community. In their own words, young people linked being in a group, safety and unity, to well-being. And they wanted safe spaces in the community to be themselves authentically. And they wanted permanency, spaces that would endure. One young person explained, "Something you could benefit a lot from is just having a safe place to go, having a safe place and somebody that they can actually confide in and say whatever they need to, and not be afraid of the place being torn down or being removed to put up something like condos." Others struggle with digital community, which did not always meet needs for connection. One young person said of social media during the pandemic, it isolated people. Even though we have ways of staying connected 24/7, we still feel lonely. Third, reduce the barriers to accessing mental health care and support for young people by normalizing seeking mental health services, by making services available and affordable in the places where young people spend their time, at school, on their phones through digital interventions, and in the community with well-trained peers and culturally competent providers. Fourth, safety meant freedom from violence, the threat of assault and harassment, but also freedom from discrimination due to race, ethnicity, gender identity, sex, or due to having a mental health condition. City policies and governance can provide this kind of protection. And fifth, environments were also important for supporting connection. Having accessible green space was a priority for young people during the pandemic because they provided access to nature as well as safe interaction. I'm just going to show one screen that shows you some of the issues that arose during the COVID pandemic. We asked one question specifically about how did people's views of the city change during the pandemic, or did they change? And people underscored the need for governance to ensure that equitable, that both health equity, all forms of equity could be enforced for people, because inequities are what stood out to many people in our surveys during the COVID pandemic, and those inequities led to the suffering of many young people and their families. Young people talked about multiple losses of family, friends to death, but also losses of opportunities, jobs, income, social support, education, and access to healthcare. They talked about social safety and belonging, as I mentioned. They talked about the need for youth-friendly support for time of crisis that specifically meets the needs of young people. They mentioned youth engagement, involving young people in policy and decision-making, ensuring that they are part of addressing their own mental health, and finally, combating discrimination. And again, ending with social connections, that this was such a critical theme that arose in the COVID-specific question, but also throughout the data, that young people needed social connection and safe spaces to foster those connections. So I've shared with you a few of our findings, but the main question is, how do we create these cities where young people thrive? Well, a clear first step is inclusive convening and co-design. So start with young people who represent the diverse communities of your city. And this is a unique moment. Young people around the world are talking about their mental health, and they have a lot to say. Surround these young people with city leadership, with teachers, with judges, with nurses, engineers, architects, the people who love their city and help to run the city. Determine the local priorities and which of the characteristics in our wonderful list of characteristics that you think are important to implement. So young people must have a true voice in co-designing for change. They know what they need, and adults must have the courage to listen to them. So start with the most vulnerable youth, because designing with them will benefit all young people. Step 2, align the work with existing priorities or targets. I don't know what those might be in Yokohama City, for example, but certainly the Sustainable Development Goals are one set of global goals. So transforming a city to support youth mental health aligns with goals to achieve sustainable development. Principles for sustainable cities include leaving no one behind, ending poverty, ensuring equal rights and opportunities, socioeconomic and cultural diversity, enhancing livability, education, food security, health and well-being. So these principles also include ensuring that urban economies are inclusive as well as environmentally sustainable. So aligning youth mental health with these is one approach as well. Learn as you go. Create communities of practice and research, groups that are dedicated to the interdisciplinary learning and implementation that it takes for complex innovations to move forward. So cities have to view themselves as creative learning systems able to imagine and design change. And we here at Hopkins and my department have been thinking about how can one create these wonderful collaborative groups to carry this kind of work forward. And hopefully we'll have more time to talk to all of you about the opportunities for collaboration. I'm just going to end with this reminder again from the Lancet Commission, the Lancet Psychiatry Commission on Youth Mental Health. Major structural reforms needed to support young people's mental health across healthcare, education, employment, and ongoing welfare remain largely unrealized. But I think we have an answer. All of these domains are present in cities, and cities may be an ideal place to start. thank you. I just want to acknowledge my colleagues and funders, and thank you for the chance to present.
Professor Collins, thank you very much for your exciting talk. So is there any question to Dr. Collins from our audience? Mr. Sasaki, please.
Thank you, Professor Collins. Thank you for your presentation. Despite Japan's high standard of living, education, and safety, we face persistently high youth suicide rates, particularly in urban areas like Yokohama, our city. How might we develop approaches to mental health care that address this, I say, paradox, considering our unique cultural context? I'm curious about your perspective on solutions that might differ from both Western and developing world approaches. Could you answer my two?
Yeah, thank you for that question. That's such an important question. And of course, youth suicide is another global health priority that I think we're all trying to understand how best to prevent. You know, I think my response to that question is going to be is going to be a question for you, because I would want to understand, what are you seeing that is working in Japan? How do youth suicides occur in Japan? And I'm not familiar with how suicides occur, how death by suicides occur there. Is the issue contagion? Do you see clusters of suicides? Is suicide something that young people have begun to normalize and see as a way to solve their problems? So I would want to understand, what is that conversation amongst young people, and amongst young people who have attempted suicide? And what are you learning from even people who have died by suicide? What are some of those risk factors that may be specific to your context? And then I think there's certainly agreed upon approaches to suicide prevention, right? Including removing the means to suicide. And I think the more upstream interventions for young people, right, that give young people reasons to live, meaning for life, and connectedness, whether to family, to school, and to peers. But I'd really want to understand more about the context in Japan, I think, in order to try and answer that question. And that's something I'd certainly be interested in learning from you.
Okay, thank you very much. So I thought maybe the most important thing is to listening to the voice of youth.
Factor which may contribute to the increased suicide rate. Factor which may contribute to the increased suicide rate among youth in Japan, like Dr. Miyazaki or other? No? You can have some comments.
Thank you for a nice presentation. It's nice to see you again. I'm Tomoyuki Miyazaki. And my question is, you mentioned belonging is very important for maintain young people's mental health. And in the first part of your presentation, SNS is very aversive to young people's mental health. But in Japan, many people had technological advantage. I mean, belonging to some community in network, social media network, is very important for communicating to others. So some aspects for SNS is aversive, but some aspect is very advantage for communicating people casually. So how do you discriminate this benefit under this kind of adverse from your opinion, depending on the duration of use of a smartphone or something like that?
Yeah, that's a wonderful question too. And my understanding of this research is that it's quite nuanced, right? Because we have studies that show, just as you've underscored, right, there can be advantages to healthy use of social media. Social media can actually provide social networks for young people that can be healthy and safe. And from what my understanding is that the safety is a part of this, right? So ensuring that when young people are exposed to social media, that they are exposed to social media that doesn't, they're not exposed to bullying. You're protecting them from the harms that can also occur. You're protecting them from overexposure to social media so that they have other ways of interacting with people as well. But you're right in certainly highlighting that both of these, there are both harms and there are also benefits to social media. And I think that's what the literature tells us as well.
Thank you.
Thank you so much for your great discussion. Now, I think that concludes our Q&A session. Professor Collins, as a session chair, I would like to express my deepest gratitude for delivering such a wonderful talk despite the late hour in Baltimore. We sincerely appreciate your sharing your valuable insights with us despite the time difference. Thank you so much.
Thank you so much for the invitation. Have a wonderful conference.
Thank you.
Thank you, Mr. Goto, for expertly chairing the first half of our sessions. We now transition to the latter half of our symposium. It is now my honor to introduce another distinguished chairperson, Ms. Yu Goto from Yokohama City University, who will lead us through Talk 3 and Talk 4. Please give a warm welcome to Ms. Yu Goto as she takes over the proceedings.
Thank you, Mr. Sasaki. My name is Yu Goto, specially appointed faculty and Deputy Director of Startup Promotion Department of Co-Creation Innovation Center at Yokohama City University. And I will be the chairperson of the following sessions today. It is an honor to introduce Takehiko Nagumo, the Representative Director of Smart City Institute Japan, with a wealth of experience in senior roles, including Executive Managing Director of Mitsubishi UFJ Research Consulting and Director of Smart City Institute Japan. Mr. Nagumo has been a driving force behind smart city development and well-being initiatives. Please join me in welcoming Mr. Nagumo.
Okay, thank you very much. Thank you for a kind introduction. My name is Tak Nagumo, founder and representative director of Smart City Institute Japan and professor at the Yokohama City University. And let's switch a gear towards a little bit more practical, what we are doing in Japan in terms of the well-being policy making. Okay, could you show my slides on the screen? All right. So let me talk about the well-being-based smart city design practices, which started to be implemented for 3 years now. Okay, and first of all, myself, the Smart City Institute Japan is the largest smart city association in Japan, with the corporate and the organization members exceeding 750, consisted of corporations, national ministries, local governments, universities, and some industry associations, not-for-profit organizations. And I've been serving as academians as well as a policy advisor to about 20 local governments right now. And let's step back a little bit to talk about why we're now talking about well-being, right? This is very important. As you know that we have been using GDP as a prominent indicator for the society particular economy. And, but GDP is quite a new one, actually created back in 1934 after the great economic crisis back in 1929. And it's less than 100 years. But over the course of using GDP, we all recognize that something is missing in economic indicators like GDP. Does it enough to measure the meaning of life? Why we are having, where we have a sense of well-being, happiness, a delight? GDP doesn't actually capture that. Sometimes over-reliance on economic growth indicator causes in the economic disparities or environmental destruction. So the first pillar is the beyond the GDP, which has been already on the plate for decades. The second one on the right-hand hand is a little bit new one, evidence-based policy making, which has been also implemented in the national government of Japan. In many ministries are implementing this idea for a few years now. And unless you measure things, you can actually implement it. You cannot achieve it. So this is ideas coming from more of the management science side. So beyond religions or just wishy-washy thought, let's put it into a science context. This is what the right-hand side is talking about. And to look into national policy measures in Japan, many major policy measures are already based on the idea of the well-beings. The first one is the Cabinet Office Basic Policy on Economic and Fiscal Management and Reform. In Japanese, this is Honebuto no Hoshin, of which you might be all familiar with. And second one is the Vision for Digital Garden City Nation Initiative under Kishida administration. It's still a continuation of the regional revitalization and the digital transformation of the regions. And even more, the National Basic Environmental Plan, and the Basic Plan for Promotion of Educations. So in short, most of the ministries in Japan are implementing this idea by and large. And look at the global context again. This is a famous World Happiness Report in a historical view. Japan is placed at number 51, right? And this is kind of a shocking number, because we all know that from the economic standpoint, we're the fourth largest GDP in the world. But when it comes to the well-being or happiness, we are the 51. This raises a lot of questions, right? The top tier are all dominated by the Nordic countries and other Northern European countries like Switzerland and Netherlands, followed by Anglo-Saxon countries, US, Canada, Australia, New Zealand, and so forth. The East Asian countries, Japan, Korea, or always sitting nearby, just below them, and China is chasing after us very quickly. And again, I'm not really concerned about the ranking itself, because the way of measuring well-being doesn't really reflect our culture, right? So forget about the ranking, but we need to think about why this happens. And to make a story short, I looked into various related documents, including OECD Better Life Index and the SDGs report and so forth. And all the factors, negatively affecting our well-being are all lifestyle related, not hard infrastructure related. You see freedom to make life choices, tolerance to others, trust in government, civic engagement, environment, and work-life balance. So if you look back our history in Japan, after the Second World War, we have quickly recovered the life infrastructure, right? Water irrigation, public transportation, buildings, hospitals, educations, whatnot. But what's remaining is the more mental part, which has been a big topic of this session. And we are now trying to bridge the psychological factors usually studied by psychologists or public health areas, and public policy, smart city, urban planning areas. So this schematics captures that idea. If you look into the bottom of this schematics, you can see the physical layer. That's where you design the physical city or regions. And then nowadays, we started to inject the middle layer, which is a digital world, right? Smart cities, digital government, SNS, which we just talked about at the previous sessions. And we didn't pay attention to the after effects of implementing those two bottom layers. So if people don't get happier, any digital transformation efforts or regional revitalization efforts are meaningless. So think it a little bit in a reverse order. We have to first identify what are factors making us happier today and design policies to enhance those factors. That's the kind of order we recognize to implement nowadays and started to disseminate in various cities in Japan. And this is a kind of tool we have been implementing for the past 3 years. And I believe this is a kind of a social innovation emerged in Japan. A little busy schematics, but sitting on top the oval, yellow oval mark indicating well-being is a typical psychological question known as the Cantor ladder questions. On the scale of 0 to 10, how happy are you? How satisfied are you with the local life? Those kind of questions. This gives you a number on, between 0 and 10. And national average in Japan is 6.5, right? As opposed to other countries, which has a little bit higher numbers. And one layer below, in the orange box, is the subjective well-being indicator areas. Data are collected through a national survey. This year, we conducted a survey collecting 100,000 samples across Japan. And the Cabinet Office conducted something similar, but just 1/10 of data collection. So we are 10 times bigger than national efforts. And in addition, one box below the blue one is a collection of the objective indicators known as typically KPIs, right? Used in the city council or corporations. And interesting part we crafted was that we created same categories of indicators at both subjective and objectives. So let's see public transportation. The effectiveness of the public transportation can be measured from both objective and subject standpoint. And sometimes, you know, we have a shocking acknowledgement after conducting 2 layers of the analysis. People pay attention to the longevity, right? So life expectancy ratio, healthy life expectancy ratio is very important. Many local governments are paying attention to it in an effort to minimize social expenditure. Yeah, right. And many people naively believe that the longer life without help from others is a good thing. And extend ideas to say, okay, longer life should be yield to happiness. But the subjective survey revealed that it doesn't really necessarily connect it to you know, the longevity, unless you have a meaningful life, right? So longevity plus meaningful life, right? Purpose of life gives you a well-being, sense of well-being. This is a kind of a benefit of having 2 layers of you know, the data sets in Japan. And this apparatus is now translated into a dashboard available to anyone on Earth for free of charge. So even from the countries outside of Japan, anyone can have a free access to it. This is a, you know, a previous version, and intentionally I created choose this one. But now it's transferred to a digital agency's website, right? So it's national. So our indicator is a national indicator today, used officially, and it includes various aspects of well-being by municipalities. So 1,741 municipalities, local governments can take a look at this. On the left-hand side, you can see overall scores, well-being and life satisfaction of the city in question. And as you go to the right, you can see a radar chart, so-called, which is a breakdown of the well-being and the life satisfaction into 24 categories. And if you go down to the lower half, you can see even more drill down the information. So subjective data sets is further cascaded down to each individual survey questions. And objective data is also broken down into a KPI level, right? They talk about the current well-being data at the national level. Maybe many of you are already familiar with this kind of stuff, right? And you can see three colors, light blue to darker blue, that indicates 3 years in a row. And the darker one is the most updated year. And the first year was a little bit lower in terms of the height of the bar, because we use a different research company. And for the past 2 years, we are using same company. Thereby, the height is very similar. In short, the national average of well-being, overall section, the far left-hand side is almost 6.5. And female feels happier than men in Japan. And as you can see a kind of U curve. You know, younger ones is relatively happier, but as you get the more social responsibilities at the age of 30s, 40s, 50s, it goes down. And as you become older, like 60s and older, you regain the sense of well-being. And the life satisfaction is something like that. So I usually joke in this kind of sessions, raise your hand if you are at the age of 40s, particularly men. You are the least happy guy in Japan, right? But don't worry, you'll be recovering happiness soon, right? And breaking down into 24 categories, factors, so-called, of well-being, the parts circled with the blue lines are the kind of strengths of Japanese community, Japanese society, as opposed to the areas surrounded by the red line as a kind of unsatisfactory areas. We can maybe intervene with public policies. And the blue areas, blue zones, healthcare, nursing care, shopping and food access, residential environment, primary and secondary education, public space, natural landscape, blessing of natures, and health, typically known as the strengths of Japanese society. But if you look at the leisure and entertainment, diversity, inclusion, and employment income, you can see from the data. This is the area you should pay attention to. Leisure and entertainment, does it mean that you have more parties? Is that preferable? No, it means you don't really have a spare time to enjoy your life, right? It's a so-called time poverty, particularly women taking care of the child, family, and working at the same time. Mostly in the regional areas with a population less than 400,000, right? So, and diversity inclusion typically is a weakness of the Japanese culture, gender standpoint, right? We are number 118 in World Economic Forum Gender Ranking Index, right? And money, we are shrinking economically, so people are concerned about what's going to happen in the future. Are we growing? Are we getting more income? Particularly people at the age of 30s are more concerned about future, income, because they are buying houses, nurturing children and so forth. And if we put it into the map of Japan, so far we have covered 668 municipalities in subjective well-being survey. We are trying to expand it to cover all of Japan, but so far this is a current situation. And the darker part shows happier locations, where the lighter part is less happier locations. The white zone is not measured yet. And I don't really show in detail, but northern part of Japan tend to be less happier. Yeah. Life satisfaction standpoint, this is more immediate, linked to your sense of daily life. That's why Tokyo, Osaka, Kyoto, Kobe, Nagoya, those three major cities indicate a darker area, darker color, right? And again, the northern part of Japan is less satisfied with the life. And also, we use this subjective well-being data to measure, analyze whether or not how the sense of well-being affects the 消滅可能性都市 cities at risk of disappearing. You can see the two axes on the graph on the left-hand side. The x-axis is the factors that suppressing emigrations. So it's a kind of cap not to lose people from the city. And those two factors affecting this was the trust in local governments and also employment income. So it's a setting floor to keep the population inside the city. If you don't satisfy this, people immediately leave. And on y-axis, you can see factors that promote immigrations, sucking people in, right? Those factors are diversity and inclusion, particularly from the gender standpoint in the rural areas, and the abundance of education or learning opportunities. So even for the adults, people at, let's say, 30s, 40s, 50s, they still need recurrent educational opportunities, right? And if you don't have a chance to learn something new, you don't really have a chance to do something interesting, you know, getting a new job, starting startups, you know, so forth. So if you satisfies those promoting factors, you have more people coming in. And the orange dot on the left-hand lower quadrant indicate the 消滅可能性都市 cities at the risk of disappearing. So, and on the other hand, yellow dots include black hole type municipalities, you know, that people are coming in. Shibuya, typically, right? And blue dots represent independent, self-sustained municipalities. The national government wants to increase this number of blue dots, right? So, you know, people tend to pay attention to birth rate or marriage rate to see the impact of the 消滅可能性都市 situation. But more importantly, looking into well-being factors will be more important to resolve the national critical issue. And let's put it into the context of the policy making, since we are bridging psychological or public health analysis to public policy formulation. Think this as a kind of logic tree. Sitting in the center, the orange bubble represent the sense of well-being and sense of life satisfaction. This section is divided into 4 subsections. The lower half, you can see built environment, right? The urban environment, and the natural environment, the nature, right? Those are the stage of your life, right? And the upper half, the relationship in the community, so social capital area, and on the right-hand top, you can see true to yourself, self-realization, your health. So let's divide them into 4 sections, and a further smaller gray bubble represents the questionnaires used in the survey. Let's assume that city of Yokohama is analyzed. And we recognize that built environment is so important from citizens' well-being standpoint. And further breaking down into more subsequent factors, trust in government, mobility and transport, food access and shopping and public space are the critical components determining the well-being of the citizens, right? So this is easily found out through this subjective well-being analysis. And subsequent to this process, let's map that with the objective KPI, objective indicators. And based on these two data sets, let's design policy, right? Urban policy, education policy, public health policy, etc. And we have been doing the opposite. We create a city first and ask citizens in a survey, do you want to keep living in the city? But it doesn't really make sense nowadays when we have enough data to analyze the well-being of the citizens. So sharpen your focus. To sharpen your focus, let's get the data first. Analyze and identify the factors of well-being of the citizens first, and efficiently focus and formulate the public policy. This is what we have been promoting with the digital agency of Japan. And as a real case studies, I just note some, low-hanging fruits outcome, because we have been promoting this idea for the past 3 years only. The first one was the city of Hamamatsu, which formulated a 10-year long master plan based upon the this indicator, subjective objectives. So it's a #1 case study. Second, more important one, I would say, is a Shinagawa Award, which introduced something called the well-being budget. The idea of the well-being budget was first introduced by the New Zealand Prime Minister, former Prime Minister Ardern. She announced this policy at the Davos conference back in 2019. And in Japan, this is the first case. So based upon the survey result, allocate more budget to something important to citizens. And I believe this practice will disseminate across Japan sooner or later. Currently, about 100 local governments are following this approach, introducing survey well-being based policy making. And it's just a genesis of this practice. So maybe in decade or so forth, we will see the net outcome of it. And I just want to show some data on Yokohama, right? So Yokohama city's radar chart is something like that. The orange line represents subjective well-being, and the blue line represents objectives. And some are close to each other, some are apart from each other, right? So this is overall Yokohama. I don't have a time to deep dive, but I'll just show you. And as compared to other ordinance cities, Seirei State Toshi, you can see a little bit similarity with the Kawasaki city, which is adjacent to Yokohama city. But if you look downward, Osaka, Kyoto, there are big differences, right? So population or degree of urbanization doesn't really indicate similar well-being components. It's different. It's different. So typically people just compare city by budget size, population size, degree of urbanization, etc. But more importantly, today you need to deep dive into the factors of well-being, city by city. And inside Yokohama City, I brought 6 words as an example. You look at the shape of the radar charts. It's very different, right? Shape and size are very different. So Yokohama is one city, but it's a large city, right? With the more than 3,700,000 population. But again, unless you deep dive into well-being factors by word, or even to a zip code, smaller areas, or gender or age group, you don't really cannot formulate meaningful policy measures. And echoing what Miyazaki-san and Professor Collins noted, we are focusing also on the younger people in Yokohama City. This is actually one of the triggers to form the collaboration between City of Yokohama, Yokohama City University, and the Smart City Institute Japan to work together to think about the policy intervention to energize people at the young age. Like on the left-hand side, you can see people at the age of 18 to 39. And as indicated in the red numbers, the degree of well-being, life satisfaction well-being in 5 years is significantly lower than other ordinance, designated city, and national average. People older, on you can see the chart on the center and the right-hand side. It's not a big concern. Sometimes it's higher than the average, but youngsters are the key concern. And this is a kind of, I myself is also a citizen of Yokohama City, is deeply concerned about this issue. And last year, we started to collaborate. And this is a picture from last year's Asia Smart City Conference, which is also taking place in adjacent location. We started to discuss what to do all together. And I wish to go down to even deeper things, but this is the end of my slides. Thank you for listening.
Thank you so much, Mr. Nagumo, for your wonderful presentation. So is there any questions from the audience? No questions?
Thank you so much for your great talk. I'm Atsushi Goto from Yokohama State University. So for your last slide, you are now discussing how to address the health, how to improve the low well-being in city like Yokohama City. But in clinical setting, we usually use the evidence from randomized controlled trial to intervene patients to improve their outcome. But in the context of making mental health friendly city, how do you think, how strong evidence should be to apply such evidence to improve the well-being in city? So there are many kind of evidence from studies.
Right, so we can think about the multiple approaches to improve young people's well-being. And as you mentioned, more clinical approach is one of them. It's more of the one-to-one, micro approach, right? So people different one to another. But also from the macro standpoint, how the city is designed is also affecting the well-being of people, the social determinants of health standpoint. So whether or not the well-being oriented long-term plan can be formulated by city council is a big question, right? And typically, local governments, the public sector, formulate the policies and budgets based upon last year's experience. An incremental change takes place, but not a big change. But taking that slow process is not really addressing changing dynamics of the people's sentiment today. People are changing, right? Society is changing, but policy is not changing fast enough. So affecting public policy, I think, is very important. And once you create a city, you cannot change it for hundreds of years, right? So you need to be very cautious about designing city, architecture, so to speak.
Thank you.
Thank you very much.
Any other questions? If not, then I think that concludes Mr. Nagumo's session. Thank you very much.
Thank you.
And it is now my pleasure to introduce our final speaker for today, Dr. Jong-Hoon Lee, Professor of Technology and Innovation Management at the Graduate School of Innovation, Yonsei University, and the former honorary mayor of Seoul Metropolitan Government. Professor Lee is currently the president of Korea Society of ID Service, one of the largest academic and industry community in Korea. He has 15 years of experience on various smart city projects, from strategic planning to real implementation via Living Lab and city engagement. He is currently the project manager for Seoul Smart City Master Plan and National Smart City R&D Planning. Professor Lee's team also has been publishing smart city index report since 2017 to observe urban digital transformation. After earning his PhD in manufacturing engineering from the University of Cambridge and 2 master's degrees in the UK, Dr. Lee has become a leading authority in smart city development and ID-based service design. His outstanding contributions has been recognized by the several ministries, including the Korea ID Service Innovation Award. Please join me in welcoming Dr. Jong-hoon Lee to the stage.
Hello, good morning, and thanks for the invitations. And it's just such a magnificent facility here as well. So I'm very, very pleased that I'm here in Japan. And thanks for the Professor Mizaki and Naguno to invite me as well. I'm just going to talk about, based on our conversation yesterday and the sessions that I think that one of a very important issue of or element of the success of smart city implementation is what I say is a citizen engagement. I think I'm going to just go over with this 3 kind of agenda. I'm just going to skip these things. One is overview of South Korea's kind of smart city development. I think as the host MC was introduced, I'm currently planning for the national and both in Seoul Metropolitan for the between 26 to 30 that what we are going to do about it, the smart city. The issue, one of the issue is actually tackling the inclusion issues, especially for the elderly people, which is very common in Japan here as well. But I think also we are looking at the immigrants and as well as the youth as well. So I think that it's really good timing that we actually get engaged here, and I just want to share these things. And second one is the work is of 2024 4th edition of Smart City Index report will be released soon. I'm just going to show the 2 dimensions, and we're going to actually present full dimension at the UN World Forum, and then also in Barcelona in Smart City Expo and Congress as well. And then third one is the one I was just talk about, the citizen-driven innovation in Living Lab as well. I'm just going to take you to the journey that what I experienced and what are actually the reflections of how the city can be worked together. The symposium is about the industry, academic, government, right? I think that this is what we call as a 4P partnership, which is people, public, and private partnerships. And those are the kind of elements of how we're going to fostering the urban innovations through the smart city as well. I think we have in our country, we have what we call as a national master plan for the smart city. We've been starting from the 2008 and then go over every year that every 4 years, 5 years that we actually reformulating the strategies and we try to see what are the focus. So first one was coming from that, but one of the key aspect or characteristic of smart city policy in Korea is the R&D. So we do the R&D, and then some of the output coming out from the R&D has to be implemented into the country, whether that is the platform or whether there's some special technology for the elderly care. Those are the kind of what we are trying to do to creating this circular of this R&D and implementations and policies together and harmonize things together to actually creating the smart city development as well. Currently, our keyword for the next smart city is hyper-connected, hyper-intelligence, and then hyper-interaction. So 3 other elements that we are thinking. Especially hyper-interaction is very important. Interaction means not only for the technology but also the people to people, and also through generation to generation, and also for the group to group as well. Just focusing on the fourth, our comprehensive things. One is I think the rest of them is also, I think probably you know, but the first one is the kind of sustainable space model. I think this is what actually we try to link together between Japan and Korea to have looking at this as a more inclusive and more sustainable spaces that what we can achieve, and how this space, whether it's virtual or physical, we have to think about how this is going to be created from the citizen perspective. Just going back to this stage, until second comprehensive plan, we are very technology driven. It was a technology push. And then third stage is where I got involving more engaging. I wanted to create a more citizen engagement perspective as well. So we see that that is very important. It's not the infrastructures, it is a soft power that creating the leaderships of the smart city. Output of the smart city R&D in Korea was mainly on the integrated platform. One of our strengths, when we look at all the Asian smart cities, one of our strengths is about talking about the platform and infrastructures, relatively compared to other countries or other regions as well. Another very big initiative is a data hub, which is a COVID-19. When tried to find the kind of there was an infector here, and then we tried to find who are in that spaces and who are actually possibly infected. Usually it will take about 24 hours, but using this platform, you can identify these things in 10 minutes by collecting all this data from police and credit card company and all these things. And usually, because of silo, you're unable to actually do this kind of creating the data usages. But in that special circumstance, creating the new opportunity and new innovative thinking that, wow, data can be very powerful in these cases as well. So that has been spread out in the many countries. Now we are rolling out data hub into the all different regions or different cities using the match funding mechanisms between public, our central government, and also the local authority together. Among that, we have our currently 244 smart city projects that are ongoing right now in every region, from strategy planning into the real implementations and also the testing out the operating different kind of model. So I would say that Korea has got a very diverse portfolio in this journey. But I have to mention that one of our lack of the area is actually the public health area, especially not just going to hospital and that, but kind of pre-stages one of our public health and welfare aspects we are using right now is checking the elderly person who is living alone. They lived most accidents happening in the toilet or shower. During the shower, they slipped and then they fall down and nobody comes, and that tragedy happened. So we are using some kind of sensors to actually detect whether that is the kind of possibly able to prevent these things. Also, we are using some kind of AI speakers to talk about and try to identify whether this person has got early symptoms of the dementia. So that's the kind of what trying to do, and all collecting this kind of data with combining with the social data together to see whether this person is safe or not. And this is also applicable to the youth in mental health as well. So because we are experiencing the aging populations, our priority of policy is focusing more on the elderly people right now. But I think it's time to shift into also the young people, that we should have a look at how this is serious. And again, I have an 8-year-old daughter. I'm deeply concerned, worry about the school bullying and all these kind of issues that will really affect the mental health of the children. And I think that's our responsibility to respond how we're going to do and resolve these things in more effective and efficient way. Going to the index report, I'm just focusing on the two aspects. We've been doing this since 2017. We publish every 2 years. The reason we publish every 2 years is we wanted to see how each city is using smart city policy or strategies implement into the city, and we want to see the effect or impacts of how this has been achieved. So we have some kind of time series of data since 2017. In 2024, we have analyzing 50 cities around the world. And Tokyo and Osaka is included in Japan. Next edition, I will try to include Yokohama as well. Yeah. And more cities actually wanted to participate this work as well. There are 8 dimensions that I'm looking at. I'm going to share with you 2 aspects because this is very important, I think, into today's context. One is urban intelligence. We're looking at the things as how fourth industrial revolution technology like AI and IoT and or big data or is a metaverse and all this kind of advanced technology has been used in the city. So we analyzing more than 5,000 projects and services, apps, and then infrastructures of all 50 cities. And we see compared to 2022, the growth of using this advanced technology into the real world was increased 55% from 41%. I think AIoT or IoT and big data becoming more general purpose technology for all cities nowadays. Whereas 14%, which is a dark blue area, is the kind of what we say is a very using advanced technology. And the area sector in here, I think the most growing sector or dominant sector of smart city was mobility. So everyone cities, that means using their technology implement into the mobility area. And we see there's an increase some cities in terms of public safety, and some health area has been increased as just single digit, but this was a huge bit difference as well. Berlin, Amsterdam, Seoul, and London was one of the leading cities to apply this kind of AI application, AI and also advanced applications as well. When I look at this chart, 14%, I just wanted to see what technology has been mostly used. And surprisingly, this year, usually in 2017 to all these 2 years, the growth was only single digit. But this year was a change to two digit, which was a 14%. And when I look at the 14%, half of all this application was using AI. So which means AI is here. AI is actually applying into the very different kind of field, including that. They are mostly focused on the city administrations, with the public services, and also using AI in mobility as well. Also, their application of robot has been merged, right? And then XR and VR, which is a metaverse and digital twin, has been increasingly also used as well. There are many other technology as growing with a very different kind of technology has been implemented into the city with the different applications. Again, as I showed you, transportation was the largest. I think the many cities are using AI application into the mobility area, but actually increasingly they're starting to using in the very different kind of area, such as city administrations to do that. So Metropolitan is now planning right now to actually apply AI application into the building the large LLM model to actually using for their internal staff to probably responding with the call center, responding all these kind of complaints of the citizens to kind of increase the efficiency as well. one of a very strong aspect of smart city, from my view, is the actually urban innovativeness. We are here, industry, academic, and government collaboration is here. I think what we call as a cluster, or is a form of alliance, is very important. I look at the old cities with how they actually have alliances, where they focus, and how do they actually growing as well. We analyzing 50 cities, and we wanted to see whether cities has got what kind of city has got this kind of a cluster. Generally, the most popular one is the cluster. So, for example, bio cluster, mobility cluster, or something like that. But in the blue one is the kind of test bed, which is the actually you testing out in the real physical spaces, and that becoming the kind of like Finland, Helsinki, like Kalasatama, or some other regions that actually physically they're actually doing something like autonomous vehicle as well. When I say the integrated, it's mixed together as well. So when you look at all these things, it is happening in the district area, not the whole city. I think that's very common things. And also they are actually building this test bed. And I think this is very important, that to attract the entrepreneur, attract the new startups, and attract the cluster, you need to have some space that you can test out. And then you try to see the reflections of how citizens is responding. So that is the kind of one of a main driver of Korean smart city on the third comprehensive plan. And then now we actually shifted to fourth one. But still, when you wanted to do the project with the government, one of the essence of the smart city implementation was citizen engagement. So citizens have to be engaged, and they have to think about how this technology will be reflecting, and also the private sector need to think about their business model and readjust the business model throughout this kind of reflections. And that becoming a kind of de facto or norms in the old cities in Korea that I show you in the projects. So one of the driving of this urban innovation was, I would say, the citizen-driven innovation as well. When I look at the 50 cities around the world, there's some significant changes. One is, I think, they are thinking about the people-centric or citizen-centric as well. Now, UN Habitat is actually will publish or will announce a people-centric international guideline for the smart city as well. And those principles and kind of initiatives are all kind of from the citizen perspective. Again, the inclusions are keywords for the all 50 cities as well. After especially from the pandemic, they are actually starting to see how we need to take care of the people, not only elderly people, but also the young generations and others as well. So I think the city becoming more wanted to not only for the climate changes and building the resilience model, but resilience model for the social resilience model as well, to have a more better life and improving the quality of life as well. One of the mechanisms to do this was I was actually involving in what we call the living lab as well. And living lab is, as I saw, is a 4P based with the people, private and public partnership. We try to communicate, we try to connect with the people, and we try to co-create with the people as well. We try to find dealing with the local urban problems. How do we resolve these problems together? Not only from the public sector to resolve this, not only from the private sector, but all together. So that's what the concept of living lab is about it. But reflection of this living lab is all different, various countries to countries. In Europe, they're very active, but in Korea, it was very shy. That citizen is not speaking out that much. I think so is Japan, probably other countries in this region. But I think people are, the young generation especially, getting an interest how their city have to be changed. What are the kind of future roles that they have to take? That's the kind of kind of impotence, or what are the kind of a philosophy, or that they can actually think about what are the cities that would problems we will have and what will be the kind of a resolution or solutions that we can have. So it is bridging the technology and human, also cities and policies, and reality and expectation. I think this is very important. Reality and expectation is the usually the gaps between when you implement in the smart city, whether it's a mobility or whether it's a health area as well. Again, bridging the present and future, and physical and digital as well. So there are a lot of bridgings that we need to think about through the Living Lab as well. They're involving as democratic participant, or they can be providing the data, or they can collect the data as well. And they actually using their collective intelligence to resolve this kind of urban problems together as well. In here that we try to see what in the form of Living Lab, about 206 Living Labs back in 2022, we analyzing what are the roles here. And 40% was talking about the co-creations. They tried to get citizens involved and solve the problems together, and using the digital tools to looking at on collecting the data to see how this problem can be tackled and understanding of that as well. There are various a lot of Living Labs in Europe and all these kind of places as well. They're using all different kind of testing, new technologies, new tools to see how people are reflecting. Again, it's important here is whether people will accept these things or not. And if not accept, why, and how this can be improved. And what are the kind of the changing behavior of citizens towards, for example, like in green economy, and using the more green mobility or that as well. So I'm going to just give you some examples that what I experienced as well. So I've been working with 3 years with Incheon, and in that time that we are trying to test out the delivery robots within the building. I think it's very common in Korea now when you go to the restaurant. I mean, when you go to Korea, you can see the robots is moving around, and that is very becoming popular as well. And we wanted to see that the motivation here was for the high-rising building, for the delivery man to go inside and then lift up, they will lose the customers in 3 or 4 customers. So because they're running by minute, right? So they're starting to using the delivery robots there. And what we try in different places, some place in university campus, some place in startup center, and some in the residence area that we try out to see whether what are the improvement they can do as well. And we found that for that delivery robot, you know that the Asian cultures, we drinking a lot of soups, and then the delivery robot actually made the mistakes. And there's some citizen ideas came out that when this soup has been spilled out with the accident, who responsibility? Is it delivery company or is it the who did that? So, you know, they have an idea that they put the black box, the camera inside of the robot. So that's the kind of the features that we can think of, how we can improve this test out as well. And another aspect was it was very popular by the 20s and 30s, early young people using these services. So we test out in the different building with the different residence age groups. And one was very young people who were living single building, a single room building, like office and all that. And what happened was it's very popular, and everybody started to using a lot rather than other buildings. And we thought, why? And we just realized that they're the age who experienced the COVID. So they don't have experience with interaction with the people for 3 or 4 years, 3 years, 4 years, 2 years. So they're more comfortable interacting with the robots. So that was the kind of very interesting finding, and that was a kind of that. But overall, what are the kind of business model they can actually develop for the new startups to think about? And I think this is very important, that when you try to do something and new things in new technology, and that you wanted to see the reflections and how this can be improved over time with the people as well. Another one is we in our country we have what we call a national pilot project as a smart city, national smart city pilot project, and one in Busan. And there are, when you go to the Busan next time, please do visit here. It's what we call a smart village. There are 56 households are there that they're living in the smart home. They are doing all technology has been inside in the house to using it, and then we see how people are living there as person or as a residence there as well. In that application, we have a public health care. So every day they're checking the health conditions and see, mental health as well, to see the housing thing. We are going to do this project with the Busan soon again, but we did a 5-year plan, a 3-year plan, a 5-year plan with them as a strategy plan, living lab plan with this facility as well, how we're going to use these things. I think this is going to be a very using innovation hub. So for example, if you want to test something regarding about the youth mental list, we can use here and then see how reflecting in the Korean students or Korean people on that aspect as well. So we try to do facilitating all these things as a living lab perspective as well. I think this kind of features are becoming very common elements into the city to fostering the new innovations and new urban innovation as well. One aspect of doing this living lab was also changing the policy and regulations as well. For example, going back to the robot, there are very heavy regulations that we trying to what we call as a regularity sandbox, which is you can, in a certain period, you can come in, you can test out as no restriction there. So try to see what other policy can be improved here, especially the public health area is very sensitive, how this information can be handled, what other people are sensitive about the information and data. We try to see the people's reflections on these things and what kind of data they should provide and give, right? So that's the kind of, again, the benefit of running this kind of citizen engagement and living labs as one of our mechanisms to fostering the urban innovation to develop the right for smart city as well, or people-centric smart city as well. So I wanted to conclude these things that thanks again for the invitation here as well. It's a great opportunity to speak about this smart city progress in Korea as well as in worldwide as well. And I'm very looking forward to actually meet you in after the sessions as well. And I hope that this presentation was useful for you as well. Thank you. Thank you for listening.
Thank you, Professor Lee, for your outstanding presentations. So is there any questions from the audience? Please.
Dr. Lee, thank you very much. Very great presentation. I'm Shimokawa from the company called Zero System. 5 years ago, together with Mayor Kuroiwa and Professor Kono, we visited Finland, Oulu, and there we went as a representing Department of Healthcare. But when we visited a hospital, a patient was, the patient, the hospital was already ready to well prepared to treat a patient. And then that visit was to see that how initiative is led by the citizens, so that the citizens there decided how to use the tax on their local initiatives. So that was the culture that already nurtured there. And so we just remembered the listening to you, your presentation. So Japan as well as Korea, we have to think how to raise the citizens' voices to be reflected on the public policies. And it's not easy. So that'd be nice if you could give us some kind of advice or suggestions on how to reflect our voices on the city the policies.
Okay, thanks for the questions and the great question as well. I think the motivating citizen is one of the biggest challenges as well. Especially, when you bring into the new technology and new kind of tools, from technologists or academy, that this will be useful. But I think the adoption is a different story, I think. So in order to have a safe landing zone of certain technology, or certain initiatives, you need to really have a strong motivations, whether that's the mayor's leaderships, or whether that is the kind of agenda or issues that we need to raise all together. But I think for the certain level of aging population with the elderly people, with the public health, that become a very common issue between Korea and Japan as well. I do not have any solutions yet, but I think we, Professor Miyazaki and all these Japanese colleagues, we try to find a way that how we can actually using, especially in the youth mental health area, that we try to find some of the way that we can provide solutions. But I think that I have to say the public, kind of policy aspects, I think you need to have a very concrete data as well to find out what are our defining problems is. I think Professor Naguma and all these people shown us some kind of data. And data-driven kind of policies is very important to actually, because it's becoming the more very objective to see that this problem is not, small, it's big problems, right? So as what we show in the slide as well. So I think motivating these things have to be done with a multi-stakeholder approach, and also we try to find the common ground. I think for me was a Living Lab was very excellent mechanisms or excellent kind of tools, innovation tools to kind of bring these issues to the people, and what are the reflections of the people that we can kind of anticipate in the future as well. We did Living Lab not only the kind of 20s, 30s people, but we also did like for the young generations or old generation as well, to see in certain technology how they're reflecting. I think again, reflections and also, for example, like climate changes or green economy, all these issues have to be go through not only from the just public channels, but through this kind of Living Lab approach to have some kind of more concrete and more kind of a demonstrative kind of technologies to realize citizens' kind of adoptions. And that's very important, I think. Yeah.
Thank you, Professor Lee.
ありがとうございました。
Thank you.
Thank you very much.
Is there any other questions? Please.
Hi, I am Takuya Tazawa from the Sasakawa Peace Foundation in Tokyo. I have two questions. Before asking my questions, please excuse the lack of knowledge about the Korean society, politics, or the private sector industry. My first question relates to your slide in the first part of your presentation. That slide said that more than 200 smart city projects have been underway nationwide. I'm wondering if the number matches the number of municipalities or the counties or other political jurisdictions, because I have no idea what kind of layers you have, the government, county, and the municipalities, 240 something. So is it possible that the one municipality is developing multiple projects at the same time?
Yeah, I think the different ministry has got different kind of projects together. So surely the city, each city will have a different kind of projects together as well. But what I represent is the kind of what we say is a smart city related projects. So that can be just developing the intelligent pole to all this kind of very comprehensive project as well. So every year, we Ministry of Land and Transport and Infrastructure, they giving some kind of a funding, kind of match funding with the private sectors to have some kind of challenge project. This can be very solution based. It can be more scale up, the large scale, and then as a whole city as well. So there are kind of 3 different layers that they're actually trying out. And that portfolio has been going on for last 5, 6 years now. So, every year that we giving like many projects to them. Again, we have a law. Some characteristic of smart city in Korea is the kind of as soon as this topic comes in, every MP is very busy to actually making this legal and legalize these things as well. Currently, we are talking about AI ethic right now, but the smart city was one of a kind of agenda for that because they are actually related with their local authority. I mean, their local region that the MP is representing as well. So I think yes, there are some political link on this aspect, but I think in overall it can lift up together to the. I know that Japan has got a revitalization projects going on as well. So we also had some revitalization project together, again with some digital adding on together as well. So that portfolio has been building up for whole last 5 to 6 years that they actually going on. And usually the project is going on for 3 years. Some R&D project is 5 years as well. So I would say they actually getting these projects and working with the private sector that using developing living labs. So one changes in Korea was each city now have got a citizen engagement. What was by the citizen engagement, and also they do some activities of citizen engagement through the living labs on other kind of innovation tools as well. So I would say the 250 projects is the small scale projects to very large scale projects together. We just ask the local authority to what kind of small city projects are they doing. So we collect from them as well. Also, we got from central government that what they're giving to them or fund them to the local authority, and we combine together to come up with the things, the numbers. Yeah, hope that's the answer. What was your second question?
Now second.
Sorry,
question.
I'm getting older, so I'm excuse me. So, but I just forgot the.
No worries. Thanks for the response. With my first question, my second question relates to the towards the end of your presentation. You introduced the introduction of the new technology coming up from the startup, mostly from startups like a delivery robots or something like that. And my question is, I'm just wondering how active or reluctant the sort of orthodox big technology enterprises like in South Korea, LG, Samsung. So I know smart city, a new idea, new concepts, and being accepted by a relatively new people with new ideas. But I'm just wondering how the Samsung, LG, or other big tech companies are responding to this trend in the society.
I think one of the significant change in Korea was actually all these Korean companies, I have to say, moving or changing their domains, I think. So if I give you an example of Hyundai Motor, Hyundai Motor is a car manufacturer, right? But now they're saying that they're in the mobility service company. So they're actually some Korean company who's been growing up from 19th to now are changing their kind of changing their clothes, I would say, to approaching the new style, a new kind of sector. Of course, they have their core competency with their city. I think LG is focusing on the smart homes. I think the LG Electronics has been quite dominant in terms of the home appliances. So they are looking at all these aspects to all homes equipments together as well. Samsung is between there somewhere. But one of a very interesting thing is the what we call as urban air mobility. So like, you know, kind of a urban air mobility becoming commercializing in 2028 in Korea. We are now building all this vertical port and all these things to, you know, how this will be used. We even try out what the price of this urban air mobility as well. So the various of this new companies, and some companies we didn't expect that, but they are doing something new, right? So I guess the Korean companies are moving that way. I think the startups and the small medium enterprise is also very active on that aspect to try out, test, and they wanted to test out in their business as well. So there is a company called DAT. That's for the blind people, that when they're receiving the message, they can, using special character to, when you touch the thing, you can read what the message is. So they have their own competency on that. So they're the startups, and they try out this in Busan projects as a kind of one of the challenging projects to put the kiosks in the underground to navigating the people, because sometimes when the people with the wheelchair when they try to using the elevator or something like that, they won't able to access that well. So they're using this kiosk to navigate where they can go on that. So that company now signed with Apple and then try to actually designing in the, you know, kind of redesign the new style, and then they actually doing in globally working as well. So it is for Korean to actually try growing this, incubating these startups to go outside as a global kind of unicorn company. And I think that everybody is doing that. But what I'm saying is, I think for the smart city aspects, you need to try out in the city, in the physical spaces, right? In the street, in the road, and all this kind of test out is very important. And I think the more cities becoming more integrated, this test bed, and then this kind of new clusters together to kind of having this kind of new spaces there. And I think that's very interesting that some capital cities, they develop the satellite cities as some kind of test bed to test out all this kind of different kind of technology. And again, they actually form in the cluster. And when you look at the Barcelona, there are textile-based city, but now there's the most innovative city in Europe as well, right? So I think you can see they're hosting the Mobile World Congress and Smart City World Congress as well. So I think again, it is city competitiveness, that how you growing this new cluster and new kind of a test bed, and that becoming a more competitive weapon or competitive resources for the smart city development around the world. And that's what we observe in 24 report, right? Okay.
Thank you. So if there are no other questions, I believe this concludes Dr. Lee's session. Thank you very much for your outstanding presentation.
Thank you for invitation. Thank you very much.
And please keep us updated on your project. And thank you so much for coming to Japan. Please come back again.
I will come back.
Okay, thank you, Ms. Goto. Honored guests and colleagues, as we conclude our international symposium, I extend my heartfelt thanks to all our speakers, chairpersons, and participants for their invaluable contributions and engaging discussions. Today, we've explored numerous ideas and innovations that hold great potential for enhancing urban well-being through collaboration. We hope the insights shared will inspire continued research and partnership beyond this event. Now it is my privilege to introduce the Vice President of Yokohama City University, Professor Masaru Tachibana, who will provide us with closing remarks. We are honored to hear his thoughts as we conclude today's event. Please welcome Mr. Masaru Tachibana.
Okay, thank you, kind introduction. Okay, so I am
Masaru Tachibana, Vice President of Yokohama State University. Thank you very much for joining us today on the International Symposium on Industry, Academia, and Government Collaboration. Imagine the future of the city to achieve well-being. Okay, so I'd like to also thank all of the speakers, Miyazaki Sensei, and Lee Sensei, and Nagumo Sensei, and Colin Sensei from online for the very exciting and very excellent presentation today. So after listening to today's lecture, I felt once again the collaboration between the government, academia, and academia industry very important to realize the smart city and well-being society. So that also, personally, I am a physicist, basic science, quantum physics. So my research field is, I'm wondering, my research field might be difficult for the direct collaboration with industry and government for the smart city and well-being. However, after listening to today's lecture, I thought I'd like to find what is the contribution of by physicists for this collaboration field. Okay. So finally, I want to tell you announcement from Yokohama City University. The Yokohama City University will celebrate 100th anniversary after 4 years in 2028. So we, beyond the tradition and innovation, we promise further development. Yokohama City University will continue to play a leading role in the field of education and research and medical. Okay, so as a hub of our knowledge and hope to serve you widely for the as a hub of industry, academia, government collaboration. Okay, just thank you very much for a kind attention today.
Thank you, Vice President Tachibana, for those inspiring words. With that, we officially conclude the Industry, Academia, Government Collaboration International Symposium, wishing everyone safe travels and good health, and we look forward to seeing you at future gatherings. Thank you all for your participation and engagement. Thank you.